is left behind.
Indeed. So joining us to unpack this critical conversation are Samsudeen Kareem, who's joining us online. He's National Deputy Coordinator of the Association of Positive Youth Living with HIV in Nigeria. You're welcome, Samsudeen. Thank you very much for joining us. And we also have Dr. Olawale Ogunlana, Public Health Content Creator and Health Awareness Champion. Yes, he is young. He's also a doctor. You're welcome. Good to have you here.
Thank you for having me, Masvino.
Fantastic. I'm also going to be asking the producers if I can tell my story on today's show, because this is a topic that's very close to my heart.
Yes,
but I'm going to wait that till I'm going to wait for the end of the show to tell that one. But World AIDS Day. Very interesting that Nigeria has come so far when it comes to AIDS awareness. I've been part of programs that have actually pushed that message to very, very hinterland type places in Nigeria. And it's very close to me, like I said, because there's an experience that I had that really cemented that. But what is the situation currently, the stats, when it comes to HIV prevalence in Nigeria, stigmatization and culture?
Okay, so thank you once again for having me. HIV in itself is actually quite prevalent right here in Nigeria. We also have we have a situation where there are reinfections. People are actually getting reinfected with HIV, new infections. And one of the things that we've discovered is that 63% of the leading cause of people getting infected by HIV are from marginalized key populations. So you have people who are, people in prisons. You have people, male partners and all of that. We have all of those things. And these are the leading reasons why people are coming down with HIV infections every single day. Now, about the stigma and the prevalence, the major issue we are facing right now is that a lot of people do not know that getting HIV doesn't necessarily have to be through sexual intercourse. It can be through other means, or the use of intravenous paraphernalia, for instance, like the use of syringes. In fact, I've had a couple of health workers, doctors, nurses who have gotten infected by HIV just because of they got a needle stab, or a needle prick that became something serious from an HIV positive patient. We've had situations like that, and if you leave it unchecked, it can become something else. But thankfully, these days, whenever you have a needle prick injury, you have to use HIV prevention therapy.
How effective is that?
It is actually quite effective. So when you use it, it actually stops. It's preventive. So let me just put it like that. So, but now in the case of treatment, when it comes to treatment of HIV, we have a situation where people are beginning to understand that your quality of life doesn't have to change because of the fact that you're having HIV. We've seen treatments, when you talk about people who are HIV positive, we talk about viral loads as well. I made a tweet a couple of weeks ago, and it kind of broke the internet, where I talked about somebody achieving undetectable viral loads, and because of that, he went to the church and gave testimony, and the pastor said, "Don't use the ARVs anymore." And lo and behold, the AIDS, the HIV came back with AIDS this time around.
Oh, wow.
But a lot of people, we've gotten to that point in medicine where you can have HIV and you can live a very high quality of life just like anybody else. So you can get to a level where the viral load becomes undetectable. That's, yes, you are HIV positive, but the viral load, which is the amount of viral copies in the blood, means that that also increases the risk of you transmitting the virus to somebody else. It can become undetectable to a point where you can't transmit it to anybody. So one of the key focus that we are trying to look at in this, when we talk about HIV now, the United Nations Agency for the Control of AIDS, that's UNAIDS, they talk about this 95-95-95 initiative, where they say that at least 95% of the population should be screened for HIV, 95% of them should be on sustained ART, that's antiretroviral therapy, and then 95% of those people should be able to achieve viral suppression.
Okay. Now, earlier, I didn't want to break your chain of thought. Earlier, when you started, you talked about people getting, I don't think I heard you right, reinfected. Did you say reinfected?
Yes. Yes.
How does that work when one gets reinfected? Is it a new strain or just
Okay,
can you
so
enlighten us?
when we talk about reinfections, like people getting like infected with HIV, we are talking about, from the key populations. There are certain people in key populations that we say are basically they're the reasons why new infections keep springing up every day. So we have people who are sex workers. We have people living in prisons. We have people, men who have sex with men. We have those key populations are key people that actually cause 63% of the reason why somebody can get infected with HIV is based on those key populations. So that is why the work that we've been doing in advocacy has been geared towards those people. Because if we can achieve some level of viral suppression to those, to these key populations, we should be able to control the spread of HIV.
Tangible percentage would be effective. That's very interesting. Let me come to Samsudeen. Samsudeen, now, how has stigma impacted young people living with HIV in Nigeria, and what steps is your organization taking to combat this? I'm hoping Samsudeen is still with us.
Can you unmute Samsudeen?
Samsudeen, I think, you have to unmute. You are muted. While you're doing that.
Can you hear me now?
Yes, we can. Go ahead now, Samsudeen. You're muted again. Samsudeen, while you're taking care of that, let me just tell a very short story, and I'm going to be very, very, I'm going to summarize the story. I was young once, and during my younger years, I was in a relationship. And I once received a call while driving down this big boulevard in Abuja, and the call was from my ex, who asked me to go check myself. At the time, I did. Well, I didn't, rather. And I lived an entire year because she had told me that she had just checked and she was HIV positive. So I lived an entire year. Yes, I see that look. I see that look. Now, these are what. So I'm coming from a place where I understand what people who live with HIV are going through, their thought process, I know what it is like because I lived an entire year believing that I was. Eventually, when I did go check, I went the long way around to go check my status. It was a bank holiday weekend, so I couldn't get my result the very next day. So imagine the trauma of going through 4 days. Friday and Monday was a holiday, and I had to come on Tuesday to get my result. And when I'm getting emotional talking about this, and when I was getting my result, I remember the counselor trying to counsel me, and I said, no, I know all about it, just give me my result. And she says, well, the drugs are not expensive. Yeah, that was what she said. Oh, it did scare me. And then she proceeded to counsel me regardless whether I wanted it or not. Eventually pushed the sheet to me upside down, left the office because she knew what was going to happen. And when I lifted the sheet, I looked at it and it was negative. And I cried. I bawled. I cried. And it changed. So long. Yes, it changed my entire life. That one moment. So I'm hoping that Samsudeen is back and has effected that change on his device. Samsudeen is not here, but let me extend that question to you. How are organizations helping people who are living with the stigma? In my case, I wasn't going to come out and say that I was HIV positive, even if I wasn't, but at the time I thought that I was. And it changed the course of my life. It kind of, I think it suppressed me a whole lot. So I'm imagining people who are HIV positive, who are being suppressed because of that knowledge, noting that stigmatization is just a thing next door.
Yeah, you see, when we talk about stigmatization, there are different components to it. And one of the components we talk about is the mental health component in itself. And then there's the societal component where people, actually marginalize people like that. There is a situation where people think that you are a philanderer just because of the fact that you are HIV positive. There are so many areas of this. The societal acceptance. People say that, like God is punishing you because you have HIV because you've been jumping around. These are the certain areas that people say that HIV is an infection that is like a curse for a punishment for people who are philanderers. And these are some of the biases that we need to start addressing properly. First of all, HIV can happen to anyone. Your story actually certifies that. It can happen to anyone. I can be a medical doctor attending to an HIV positive patient with a very high viral load in the theater, and then I get exposed. It has happened before. Certain times when I'm having cesarean sections with patients and then I get a knife cut. It happens. It happens all the time. Or the lead surgeon just mistakenly pricks you with the suture. You know, you can easily get infected. It's not, so saying that, you know, HIV is a curse on someone, it basically, the way it affects the way we see HIV. And then because of that, people can't say it openly that, oh, I am a person living with HIV. And because of that, people are also afraid to go for treatment.
Yes.
And because of that fear of not going for treatment, that is when we see HIV progressing into AIDS and then becoming as devastating as it could possibly be.
You're going to help us make that differentiation. First of all, ARV, antiretroviral drug.
Yes, antiviral, yes.
And then now you've just repeated that where it progresses from HIV to AIDS. While I understand what it is, I'd like to clarify what you mean with the difference.
Okay, so basically HIV in itself is the human immunodeficiency virus. So when people have it, like basically one of the key things about HIV is, number one, it replicates very fast. Number two, it targets the immune systems, right? So when we say human immunodeficiency virus, so it means that it targets the immune systems, the immune cells. And one of the things that it does is that it attacks them, it attacks and replicates from that. And so that means that your immune system is basically like your bodyguard. So it provides first line of protection against anything. You can see that maybe today you might notice that you're sneezing today, and then tomorrow you're no longer sneezing. Why? Your immune system has actually attacked it and gotten rid of it. But in the case of HIV, what happens is that those immune systems start getting attacked. So something as simple as a flu, to somebody who is dealing with HIV, it can be as if they are dealing with a life-threatening disease that is about to kill them. Why? Because the immune systems are absent.
So now that's
So
HIV.
yes. So then there is, then the more it continues, it starts affecting different organs. So that's when it now becomes like, for instance, they can have, full depletion of their immune system. They can start having serious, what do you call it, complications in their liver, in their, around their body. There can be co-infection, especially with TB and hepatitis. And because of that, it starts leading to what we know as acquired immune deficiency syndrome. So that's a complication of HIV, where
the organs are broken down.
There is already like multiple system failure in different areas of the body. So just to put it, as simple as that.
One other thing, doctor. I'm sorry, Dashi. But it goes with the story. Now, I also learned why I did not have HIV, even if we were active. And it was something called being a discordant couple, if you could explain that.
Okay, so...
Also, while you're explaining that, I actually wanted to ask if there are people who are immune to HIV and what makes, their system different.
Yeah, that's where we talk about, serodiscordant couples. Well, like serodiscordant, like it is very possible for you to have HIV and I don't get infected, because there are some people that are just quite, how should I put it? They are immune. They are not at risk of getting
Our questions actually go hand in hand.
Yes, so they are not at risk. So it's very possible to have an HIV positive woman and the husband is HIV negative. So they are basically...
How does it work?
Yeah, exactly. That's what we want to know. What makes them
there are a lot of different theories and explanations for that, but some people say it's it's genetic, it's environmental. It also depends on the exposure of the person per time and the viral load of the individual as well. So because viral load is also very important, there are some people that have, if you have a very high viral load, it automatically means that your risk of transmitting the virus is high. But if you have a low viral load and it is well controlled, it is very possible that you will not transmit it either to your partner or to anybody else.
So it's not a matter of being totally immune.
There are a couple of factors that are
but at the wrong time, if you continue that way, you might just get infected.
Some people get infected from HIV just through blood transfusions. There are some people that get infected that way.
Okay, now let's find out from you. You did give an example earlier about a tweet you actually made, and we know you're a content creator as well. What are what are people like you, that's content creators, doing? How are they using the social media and also digital platforms to, push and create awareness on HIV/AIDS?
Okay, so one of the key things that I like to use my platform to do is to educate the public on health. And one of the key messages that I like sharing is HIV in itself is not a death sentence. So meaning that the fact that you come down or that you're infected with HIV doesn't mean that you should you should give up, right? Because right now there are treatments that are existing treatments right now currently in Nigeria that allow people living with HIV, number one, achieve proper viral suppression, that is, they can no longer transmit the infection to anyone else. And then number two, they have high quality of life just like you and I. Like anybody else that is living with HIV, they are also living a very high quality of life just like anybody else. So one of the things that we try to educate people, and I remember when I made that tweet, it actually got to some places, and there were a lot of discussions. And presently, even the UNICEF is on the discussion right now. We want to talk about it. We are trying to ensure that, number one, people that are living with HIV must must be on sustained antiretroviral therapy. And regardless of who they are, regardless of their religious beliefs, regardless of their sexual orientation, in fact, those are the things the UN, WHO is all about, like we are talking about this year. One of the goals is to ensure that everybody living with HIV has a right to good treatment. That's exactly the focus of today's awareness. Okay. So yes, the whole idea is to educate them and to also provide a means of support. The fact is, currently, there are a lot of support communities that exist for people living with HIV, which is one of the things that is enabling people to be more consistent with their treatment and also live a much better life.
I'm being told that Samsudeen is back with us. Samsudeen, are you there? Can we test your audio to be sure that you're with us, Samsudeen? Fantastic. Samsudeen, I asked earlier what organizations are doing to help people who are living with HIV or dealing with stigma.
Yeah, thank you so much again. I'm sorry for the technical issue. And so to start with, CSO's youth organization, actually patient community like mine, we're doing so much. And to start with, from what Dr. Ogunlana was saying, being HIV positive does not define you to be promiscuous or whatsoever. Someone like me, I've been living with HIV since birth. I think about 24 years, and it's been a long year with antiretrovirals, and stigma still like the biggest challenge we are having, especially around promoting HIV awareness. And we've identified a lot of factors to be responsible for that. And one of the strong things is even the self-stigma. Personally, growing up with HIV, I could say I experienced the side of the self-stigma. I know there was a time where I needed some information about HIV going on, but they weren't there probably because I lack a proper disclosure processes that should be given to every child with HIV. And trying to learn about HIV on my own was quite disastrous. The fact that I had to learn the negative part of HIV, the part where they say you can't have your own life, you cannot be whatever you want to be, you cannot have a wife of your own, you cannot have children of your own, you can't be something substantial. So it's got to a point where it's affected me mentally. I had to be taken in and out of clinic. It's even got to a point where I got admitted for a while in the psychiatric clinic. So it's part of that self-stigma that we need to sort of tackle with. Another thing that has been a big challenge with stigma is, I would say, healthcare space. In Nigeria, according to start with, I think the issue of doctors migrating from Nigeria to European countries, America, UK, and others has been a huge challenge with stigma. And a lot of our healthcare workers are quite fatigued, which does not give them enough time to provide substantial information that needs to be given to PLHIV. And a lot of time people just go to clinic. We have, I think the recent one shows we have more than 1.6 million. The data is showing that we have more than 1.6 million with HIV. Imagine that number going to clinic where we have few healthcare workers to attend to them. they have to do what they have to do to just get them done, and they leave and go home like they want to do. So that special attention to helping young people live with HIV to know what they need to know about the status is not there. Just come to the clinic, give them the medication that they needed, and they all leave, and the same cycle continue all over and over. So we need to do that. And youth-friendly centers, we need to I've identified that there are no youth-friendly centers per se that are really functioning to assist people living with HIV to understand what they are taking the drugs for. It's not just people with HIV that talk about youth-friendly centers. For me, I finished from the University of Ibadan, and quite a number of time, I can't even count the number of time I went to the facility because I don't find it friendly. I don't find the friendly center friendly. So, and there's a huge knowledge gap of what people that are not living with HIV are knowing. Even the recent effort by international partners, they are trying to boost the empowerment of people with HIV. They provide them with substantial information they need to know about themselves. And for example, there's a post there by PEPFAR, the PEP project, that's the Patient Empowerment and Education Program. But we need this kind of program, not just for people living with HIV, but for the entire space, like the whole young people in the world, in the country. We need them to know that when they meet someone living with HIV, this is what it means to live with HIV. These are the things they can do, these are the things they cannot do. But there's a very huge knowledge gap of what people out there. Apart from me, it's probably I've been with HIV for 24 years. I know this is what HIV entails, this is what I should do, this is what I should not do. So we need to take it out there. There are PrEP, there are PEP, there are a lot of substantial plans to curb the spread of HIV. Like Dr. Ogunlana rightly said, the PrEP, the PEP, the zero discordant couple. I mean, I can decide because I'm HIV positive does not mean I have to marry someone that is HIV positive. That's general, even in the community. They always do this matchmaking. But the HIV continuum of care has gone beyond that. I don't have to settle for what I don't want just because I'm HIV positive. I can widen my tentacles. There are a lot of plans that the U equals to U program, the undetectable equals to untransmittable. When you are addicted to your drugs, you get to a certain point where you cannot transmit. You can have your children you can have your wife and you won't infect her. You can have your children and they will be giving birth without the virus.
Now,
so all those
Samsudeen, I hope you can hear me. Samsudeen, we have a very little time, but you've mentioned some very critical things that I need you to really expatiate on. You talked about the knowledge gap when it comes to people living with HIV and what other people should know about them. We also note that you just said that you've been living with it for 24 years. And now you talked about the centers, the youth-friendly centers that aren't friendly. What suggestion do you have as a leader of one of these organizations that has the interests of people living with HIV/AIDS at heart? What suggestion do you have for maybe the government or authorities to make these centers truly youth-friendly?
Yes. So to make it youth-friendly, I think we just need to put some policies in place. For example, let me go back to University of Ibadan. There's a course, they call it GS107, which is sexually transmitted infection. I believe it talks about HIV. We need government to make that kind of a curriculum compulsory for university students so that they go through it compulsory. It's compulsory that they go through it and they have understanding of it. And the centers, let's have those kind of centers across the country where people can go into and have a first-hand knowledge of what they should know about the virus. And another way of thinking that, for example, I've been thinking we need to do so much of media awareness. Personally, because of the year, part of the plan is I want to go deep into creating more awareness. Is I decided to make a documentary of story of myself. It's titled "Call Me Shams." It was shot by an American filmmaker, Jeff Brown, and we shot it here in Nigeria, in Abuja and Port Harcourt. It's like a 10-minute short film documentary to explain everything about HIV, to help people living with HIV know that irrespective of their status, they could be whatever they want to be. For me, at some point, I believe I cannot travel around the country. And today I'm trying to tell you that with HIV, I've gone to several continents. I've gone to several countries with HIV. So the documentary is out there. it's going to be live, public. It's not yet public, I mean, but it's going to be public soon. We're just trying to take it to film festivals so that we can engage filmmakers. We can change their orientation. We can let them know how they can help us with the media angle of promoting HIV and see what can be done differently. Also, you would agree with me that with media, we can get it right, because how did we get here with stigma in the first place? It's media. I remember in the early days of HIV, when they are going to describe anything HIV, they're going to put a picture of a sick person. So that definitely they are trying to pass information, but the information they are trying to pass, they are not being strategic. It's create this kind of apathy against people with HIV. Like, people living with HIV, they are always sick. So anytime you see someone that is even sick, the first guess of people is this person is living with HIV. So we need to have strategic communication patterns to communicate HIV education. Let them know this is what it means to be HIV. These are the systems in place to cover HIV. This is what I need to do to also protect myself. And I think with that, we are going to go a long way fighting stigma and promoting the awareness.
All right, now, Dr. Ogunlana, just before we go, we just have a few minutes left. Can you, I know you have something to say, about everything that he's actually said, but then while you give us your final words, what advice do you have for, those who are hesitant to, go and test? Yes, that's one. And also, I'd actually love to know, because I know some people have actually, they actually have a habit of, I think there's some test kits that, homemade test kits that you can actually have
home
use test kits that you can actually have. And, does that actually count? That's another question.
Okay, yes. So the first question that you asked, for those who are refusing to get tested, it's important for you to know your HIV status.
And also preventative measures that can be taken.
Okay, so it's very important for you to know your HIV status. I do it every year, not for any reason, but just because it's...
we're not stigmatizing.
Yes, but it's, it's just a very important routine that you should have. Like every year you should. In fact, I advocate that every year you should go see a doctor and get yourself checked. Every human being is just like a car. You have to service it at some point. So checking and, frequent checking. So now bringing it down to HIV is very important, because you need to know, what is my risk? Am I a zero risk to somebody else? Or am I a risk to someone? So if you're HIV positive, that means that you can be at risk to someone, but it is possible that with treatment, you can be a zero risk to someone. So that in itself can make the world of difference. So it's important to ensure that you have to get yourself tested and get yourself screened. And if you're afraid and you say, okay, you feel stigmatized, you don't want to, you can reach out. Like some of these home test kits, they work, right? So, but then you have to know that in case you get maybe the test result is positive, you still need to go for further testing, because they are basically, what we do here in Nigeria is what we call serial testing. So we test first, we determine, and then after that we move to Unigold and then Start Pack. So like there are 3 different tests that are being done, unlike other countries where they do everything at once, and then they get, which is parallel testing. So, but then it's important for you to get yourself screened, right? Do it, find out. If you're negative, you're negative. If you're positive, then you need to go for further tests and screenings to know if that is, if that is the case, then start treatment. Then when you are on ARV treatment, I think it's very important for me to say, knowing that we are on such a big news platform, it is important that you continue your antiretroviral drugs, your ARV drugs, even if you have achieved suppression. Even if. Yes, it's possible for you for the viral load to become undetectable. Yes, it's possible for that to happen with the current line of treatment that we have. But then you have to ensure that you keep using your ARV to maintain suppression, right? And it's very possible, because now we are even getting new types of, resistance when it comes to ARVs. So we have to ensure that it is consistent, that you consistently use the medication. Then finally, for prevention, I think it's important for every one of us to know that we need to make sure that whenever we are going to be interacting with blood products, we have to be very safe. Like, we have to be safe For partners, they need to be safe during sexual intercourse, make use of contraceptives, proper contraception, especially if you're going to be engaging in sexual intercourse and the likes like that. But let me leave it there.
The home kits, do they work?
Yep.
The home kits.
They
The home kits, they work. Yeah, they work.
All right, good. Well, Samsudeen and Wale, I can call you Wale now.
Yes, you can.
I want to say thank you very much for you two gentlemen for coming over today and giving us your expert opinion regarding the situation and also the awareness for World AIDS Day, World HIV and AIDS Day, which is today, by the way. So you want to go out there and make a positive effect on people living with and at least just stop the stigma. That's all I'll say.